Good evening and welcome to the Arthritis and Anxiety Coping Strategies and Treatments webinar. My name is Penny Greenblatt. I'm going to be the moderator for this evening. I'm a retired licensed clinical social worker, and I'm now spending my time making music, volunteering, taking classes, and coaching Special Olympics. I'm also an arthritis patient, and I've lived with psoriatic arthritis for 42 years, about. I also co-facilitate the Arthritis Foundation's Psoriatic Arthritis Connect group, which meets online. Living with a chronic condition like arthritis isn't just physically tough. It can affect our emotional and mental well-being. Tonight's experts will share ways to help you take control of your mental health, whether it's through self-management or with a designated mental health professional. You can direct any questions you have throughout the presentation to the Q&A box at the bottom of your screen, and there will be a Q&A session. We'll start with the presentation and reserve some time to answer the questions at the end of our discussion. After tonight's session, you'll receive an email asking about your experience. These surveys help the foundation better plan for future events, so please take the time to fill them out. It's only a few minutes. A recording of tonight's event will be available in 1 week on the Arthritis Foundation's YouTube channel and Webinars Hub. You can also view upcoming webinars, which are hosted monthly on the Webinars Hub, and past recordings on our YouTube channel as well. Tonight's goals, we're going to be learning about the mental impacts of living with a chronic illness, strategies for reducing stress and building resilience, how to recognize signs of anxiety and related disorders, when to seek help and mental health resources, and how others in the arthritis community cope. There's some additional resources. You can learn about managing your anxiety with arthritis through these. If you're not able to get them down quick enough, you can always just go to arthritis.org. There's lots of information and you'll be able to find info about managing anxiety. Okay, I'd like to introduce tonight's experts. First, we have Brentia Caldwell, PhD. Dr. Caldwell is an Atlanta-based private practice licensed professional counselor and counselor educated, serving individual adult mental health clients and emerging clinicians seeking counseling licensure. She also facilitates counseling support groups, lectures, and other therapy-related services centered around disability education, with an emphasis on life navigation and life satisfaction. Next, we have Destiny Davis, LCSW. Destiny Davis is a licensed professional counselor in private practice in Atlanta, Georgia. She specializes in helping people with invisible illnesses and disabilities find joy in their relationships. She hosts the Chronic Illness Therapist podcast, as well as monthly workshops, and provides individual therapy to those looking to improve their relationships with themselves, their families, and their communities. Destiny and Brentia, take it away.
All righty. Good evening. It's Dr. Brentia. So Destiny and I wanted to start with a disclaimer, okay? We are not doctors. So please don't leave this webinar and maybe do something that we discuss or recommend and then, blame us, right? So this webinar is not intended for medical or professional advice, only for educational purposes, okay? Always talk to your physician or therapist before making any changes to your care plan. So why are we here tonight? Well, with adults with arthritis have between 2 to 10 times greater risk of having anxiety or depression. Also, 22.5% of adults with arthritis report anxiety symptoms, and 55.6% of adults report chronic pain who have chronic pain or report chronic pain also report anxiety and depression symptoms. Just really indicating the close connection between pain and anxiety. All right, and so there is the pain mental health connection. So you feel pain, it causes you stress. Stress induces inflammation, and because you're inflamed and in pain, you can start to feel depressive symptoms and anxiety symptoms, and then that causes you to withdraw. So sometimes you'll have a lack of interest in social interactions, and then also a lack of motivation, a lack of interest in engaging in physical activities as well. So fatigue and other health problems, including worsening disease activity, can worsen this cycle.
Okay, and living with uncertainty is probably one of the hardest parts of living with any chronic illness, because as we all know, it can ebb and flow. Our good days can be half a day, they can be a week long, and our bad days, same way. So some of the common fears that I often hear from clients and people that live with chronic pain are things like flare-ups and symptoms just kind of wrecking our future plans. So will I be able to go on that trip next month? How am I going to handle this move? Can I start a family? Things like that. We often have fears around worsening illness and even going to the doctor. We often experience hardships around our medical care. So sometimes those fears come up, as well as relationship issues, explaining what's happening to your partners, to your friends and family, and feeling understood. And also, what about when you're in a good place? Fears will pop up, like how long will this last? And it can be a little debilitating sometimes. So there are some things that we can do to help the anxiety of it all. We can't cure our illnesses, but we can do things to help mitigate how much fear we have while we're living. And Brentia and I both want you to know that there's hope. I have a family of my own. Brentia, if you want to share about yourself.
Sure. And this picture is a picture of me and my honey. We get married in April, and we just try to live a good life in the midst, instead of saying in spite of, in the midst of me having a chronic illness, because I do have lupus.
So I practice something called acceptance and commitment therapy. And just like the name says, there is a lot of acceptance work around it. And that word can sometimes get people. It often feels like it means we just have to tolerate what's happening and, just kind of suck it up and deal with it. That's not what we're talking about here. Acceptance is really just feeling what's happening in the present moment without judgment and not trying so hard to fight what's happening. So we can work to make change in the future, but we don't want to fight it so hard that it causes all this extra stress in our body in the present moment, which actually makes it harder to make changes later on. So acceptance work often, it might sound a little counterintuitive, but we actually learn to accept really difficult thoughts and feelings and bodily sensations. Again, once you allow it to be there, ironically, that's when the change can start to happen. So it's a bit of a process in learning how to do that, but there is acceptance and commitment therapy does help teach you how to do that. And the whole goal is to help you to start behaving in ways that make you feel empowered and make you feel alive and make you feel like your life has meaning and purpose. So again, we're not telling you to accept the pain. We're just trying to get rid of the I'll be happy when, because if we constantly live in the I'll be happy when, the when never comes. So we learn how to manage what's happening in the moment and still live our life despite the pain. So some tips. A lot of times what gets in the way of acceptance is when we start to find ourselves in really rigid right and wrong thinking. This is the right way to eat. This is the wrong way to think. This is the right way to move my body. This is the wrong way to move my body. Most things have a lot of nuance to them, and there isn't a whole lot of absolute rights and wrongs when you're managing a chronic illness. So avoiding your emotions and sensations, that's also something that can get in the way of acceptance work. Cultural pressure, feeling misunderstood, lack of accommodations. This is a big one. It's not all on you. Sometimes our world is really just not set up to accommodate us in the way that we need. And so the part that's our responsibility is recognizing that, taking the blame away from ourselves, and then asking for what we need. And again, you might not always get what you're asking for, but it's still important that we're learning how to do that so that we can figure out what accommodations we can get. So in acceptance work, we do a lot of clarity around values. So really figuring out what's important to you. Properly grieving, really giving time and space to the grief and the feelings that come up. Learning how to handle distress. There are skills we can learn to tolerate distress. And again, that doesn't mean that you just learn to be okay with it. It means distress is a part of life. It happens, and we have to learn how to build our resources so that we can handle it and move through it and get to the other side of it over and over again. Additionally, having community and support also helps us improve our acceptance, as well as proper medical care and confidence within your self-worth. I also practice somatic therapy. This is a therapy that is somatic experiencing in particular. It's a therapy that really encourages you to pay attention to what's happening in your body. Pain is a traumatic experience in and of itself. Living in a body that has pain on a day-to-day basis it means there's constant distress happening, and there is an inherent trauma in that. The good news about trauma is that we can heal it and work through it. It doesn't mean we get rid of again, not everything can be just removed or gotten rid of, but there are ways to learn how to navigate it. And the biggest piece about somatic therapy is really learning how to build safety in your body, improve resilience. And we do this work really gradually and titrated, very small little bits at a time, so that we don't overwhelm your system. Some common somatic practices, you might have already heard of some of them. Body scanning, this is where you just close your eyes, center yourself, and go from head to toe in your mind and just bring awareness to different parts of your body without judgment. That's a slow process. I just said that quickly, but it's a lot slower than that. We also want to track physical sensations and learn, how big does this pain feel? How heavy does it feel? How intense or light does it feel? Is it staticky or buzzy or achy? Those labeling of the experiences inside of us help us also, one, learn how to tolerate the distress around those pains. It helps expose us to these painful sensations in a way that isn't so distressing.
All right. As for me, my core philosophies, for the main one is learning to be soft, and not necessarily meaning to be weak or mild-mannered or things like that, but just to really adjust your life according to your diagnosis. So really extending grace to yourself, understanding that maybe some of those old abilities are no longer present, and learning how to work around them, and also giving that grace to others as they adjust to the newer you. As Destiny was saying earlier about accommodations, right? You want to be able to advocate for yourself and express the different needs you have so that you can be accommodated. So, for example, maybe you're heading out on town. You're going to have a good time. Maybe you want to park close, right? Or if you're with friends, have them drop you off at the door. Just things like that. But being able to express yourself, to get your needs met, and trying to decrease some of maybe the shame you may feel for just, adjusting to your new self. Also, just remembering to partake in some of your personal interests and hobbies, and understanding that you might not be able to do them the same, but still trying to work, find a workaround so that you can enjoy yourself and still, establish some type of normalcy. And then self-care. I know that's a buzzword nowadays, self-care. But it's really important to really prioritize your wellness. So it may not look like getting your nails and hair done. It may look like taking a nap, right? Or saying no, like setting boundaries. So really determining what, would help you best prioritize yourself. Also, with learning to be soft is checking those self-imposed standards. Um, as Destiny was describing earlier about I'll feel better when, the truth is sometimes that win may not come. So really being mindful and realistic with what you expect your body to do. It's just really important. So being mindful of some of those self-imposed standards. And then, soft life, you got to rest, okay? You have to rest your body, you have to rest your brain. So just really being mindful and intentional about setting aside some time to just for nothingness. I like to discuss that with my clients, just having some moments of nothingness, mindlessness. Um, and then the second piece is listening to what your body is telling you. So it's helpful in detecting oncoming flares. So I have lupus, my body will tell me when it's coming, right? But also the second bullet point of just finding balance of listening to my body, but not overreacting, self-diagnosing, putting myself in a tizzy, which will again make me feel worse. So just being mindful of that. But mainly just understanding that you need to ask yourself, in this moment, what do I need to feel my best, to take care of myself? So that's a really important question, to kind of be in the moment and to just check yourself and just check your needs. So with anxiety, how it shows up in the body, you'll have an elevated heart rate, chest tightness, headaches, sweating. So you get the sweaty pits, sweaty palms, right? And then stomach problems. All of the gastrointestinal issues that can arise from just having anxiety in your body, feeling shaky, or like, having tremors, feeling tremory, dizziness, and then trouble sleeping, and then fatigue, which is that constant feeling of exhaustion, tiredness, and then blurred vision. And then in the mind, obviously, what we're talking about, anxiety, excessive worrying, right? The just ever present fear of what's next. Am I going to have to go to the hospital? Am I going to die? All those things, right? So racing thoughts, restlessness, irritability, and irritability is one that I discuss a lot with clients. Um, because sometimes, yes, when we have an attitude, yeah, it's probably because we're feeling anxious, right? We're having some other issue in the body. It's not necessarily that person that's well, it could be the person that's irritating us, right? But yeah, we can have irritability. That can be one of the manifestations of having anxiety in the mind. Difficulty concentrating, challenges with decision making. So kind of that all over the place, like your brain feels all over the place and it's hard to like lock in and make decisions and sometimes make sound decisions. And then dissociation. So sometimes we feel so much anxiety, so much worry, our thoughts are everywhere, that we just unattach from reality, right? We just take a break. And so, yeah, these are ways that anxiety can show up. All right, negative coping mechanisms. So no one is perfect, but self-destructive behaviors can get out of control and it can exacerbate your arthritic symptoms or just any type of autoimmune disorder, uh, or conditions, right? So avoidance behaviors. Sometimes when we are dealing with um, autoimmune disorders, chronic illnesses, we'll isolate, we'll withdraw, which is probably the opposite of what we should do, because community assists in wellness when we are dealing with chronic illness, right? Sometimes, especially with arthritis, we'll just altogether decline from participating in physical activity, which can also exacerbate those symptoms. And then on the flip side, sometimes we can do a little too much, right? So the excessive behaviors, the binging behaviors, which again can exacerbate our symptoms. So even with social isolation that I just discussed, sometimes we can get too engaged and we're constantly busy, constantly overextended, and then that can impact, negatively impact our wellness. So just being mindful of that. And then the flight or fight responses. So always being in survival mode, that can exacerbate chronic illness conditions as well. So really learning how to function in the gray area, um, taking your time with things, taking a moment to stop and think before responding physically, emotionally. But yes, all those things can impact how we navigate chronic illness.
So, what is normal anxiety versus clinical anxiety? And we do have specific criteria in our diagnostic manual that helps us diagnose mental health conditions that does help guide us whether or not you have a full-on anxiety disorder. This is not exactly that criteria, but we wanted to just give you a snapshot of and to let you know it's okay to feel anxious sometimes. It's okay to have feelings about this and to feel negative about it and to feel sad or angry or irritated, and so for example here, a normal anxiety is tied to a specific stressor or situation, right? It makes sense to feel anxious and angry and upset about some things. And the intensity of it matches the situation. And then it subsides when the stressor passes. So then on the flip side of that, with an anxiety disorder, the intensity kind of goes higher than what that specific situation may call for. And don't let that make you feel like it doesn't mean you're overreacting. It's quite the opposite. When you live with something chronic, these things tend to kind of build up over and over and over again. So it's not that you're like overreacting if your intensity exceeds the specific situation. It's just that you've had a lifetime of situation after situation after situation build up on top of each other. And that's where therapy can come in and help you mitigate that. So it doesn't change anything that has happened to you, but it does help you and your brain kind of learn how to handle the distress around chronic, complex difficulties that happen over time.
All right. So other strategies and treatments. So for CBT, cognitive behavioral therapy, which is I would say one of my core modalities in terms of treating clients, it's just the identification and transformation of negative or counterproductive thought patterns and behaviors. And the core concept is that we think away, it makes us feel away, and then we behave away. Okay, so just the interconnectedness of those three concepts. And then we have EMDR, which is an emerging modality or practice that helps individuals process traumatic memories. And with, trauma being another buzzword, people are, starting to connect with maybe some of their past experiences that have truly impacted them. And yet EMDR helps to, treat trauma. And having a chronic illness can be traumatic. If you've ever had a hospitalization or a crisis, right? How that can make you feel and what that can do to you internally, mentally, physically, it can definitely be traumatic. So EMDR can definitely be of assistance to someone who is dealing with the true trauma piece of having a chronic illness. And then antidepressants or any just type of psychotropic medication that involves like the chemical component of mental wellness. And there are a variety of antidepressants and medications out there. And again, Destiny and I are not doctors. You need to see a psychiatrist for that. And primary care physicians, um, they can definitely prescribe. My recommendation is that you see a psychiatrist. Yeah, so
Yeah, I would say the same because they just understand so much around the nuance of each medication,
yeah,
and medication is an art and a science. So sometimes it does take trial and error, and psychiatrists are very well versed in the intricacies of it all.
yes. All right, so seeking professional help. So obviously, you have two therapists on the call. Yes, talking it out, getting techniques on how to navigate life with a chronic illness, super important. You can get that assistance from mental health therapists, right? Then you have functional medicine practitioners who use a more holistic approach, discussing diet, physical movement, things of that nature. Massage therapists, I love a good massage, right? Release the tension, release the stress from the body. And then you have occupational and physical therapists who can help you to get acclimated to like your newer body post chronic illness diagnosis, because especially those with arthritis, sometimes you might lose the ability to do some of the things that you used to do. And so these professionals kind of help you get back in touch and help you to find workarounds, to assist you to feeling more like yourself. And then chiropractors are another professional who can assist. And some of these insurance will cover. There are always self-pay options. It's best to seek guidance with your insurance providers to see what they will cover. And then also understanding that there are funds out there and some individual practitioners who offer reduced rate pro bono services as well. So that's just something to know. And then with hospital healthcare navigation, self-advocacy is key. Even if it is the smallest thing in your mind, write it down, tell your care team, okay? If your pinky toe is a centimeter shorter, to just tell them, okay? It's important that you advocate for yourself and you let your care team know everything that has been transpiring with your health so that they can assist you, okay? You want to have an intentional care team, okay? So being very selective with who you choose to, provide your care. Um, and that can look a variety of ways, but you want to make sure that your care team is in tune with your needs and they respect your thoughts and opinions and they prioritize your wellness, okay? Like I had just mentioned about identifying healthcare resources, there are funds out there, there are um, grants, pro bono services, there are, insurance providers that can help you to get the care that you need, okay? And then also just ensuring medical record accuracy, making sure that your care team or whoever your providers are have accurate recordings of your appointments, the medications you take, your symptoms. That's really important to ensure proper treatment, proper care. Okay.
I wanted to add to that your insurance often, I think all of them have patient advocates. So please call your insurance companies and ask them for a patient advocate, as well as possibly, especially if you have a lot of different care that needs to be managed, your insurance should also be providing you with a case manager. You do have to call and ask for these things, but they're no extra cost to you. And I did a little bit deeper, more information on that on episode 79 of my podcast, if you want to listen to that. And Brentia, I just wanted to say that learning your new body was my biggest takeaway from your last slide. That's probably one of the most important things. Like, you have a new body.
Yeah.
So it's important. These are two really good books. The Happiness Trap by Russ Harris also speaks to what we've already talked about today. I'll be happy when never really happens. So we have to live in the moment now. And then things might go terribly, horribly wrong. Basically, again, acceptance and commitment therapy. Things will happen. Things will not always go according to plan. And so then how do we deal with it? And these two books are phenomenal at explaining that. So here are some of our resources. I have a previous workshop. It's on YouTube, How to Stop Fearing Your Body. My podcast, The Chronic Illness Therapist, I interview other therapists and licensed medical professionals about chronic pain and illness. We're basically just trying to flip the script on not being believed or, being minimized. And so I am trying to find any and every medical professional I can who will come on and talk to me about how much they care for their patients so that you all know that we are out there. I do have a membership at $17 a month, mentally well while chronically ill. And I also do, and that's open to anyone. And I do individual therapy for residents of Georgia, Florida, and Colorado.
All right. As for me, I do individual therapy for residents of Georgia and Colorado, and I do offer a counseling support group. Please know that both of those are on hold until I exit my bride era. So once I am married and settled, we'll start back the counseling support group for chronic illness, which is free. And that is for the residents of Georgia. And then I will resume accepting new clients, individual adult clients.
And I do work with kids and teens only specifically when they have a chronic illness. And then, of course, the Connect groups with the Arthritis Foundation are also available to you all.
Okay, that was a fantastic presentation. Very, very informative. Now we're going to pivot to our discussion, working through common fears. We have a panel tonight, including myself, who are going to share their experiences about living with the stressors of having a chronic illness. We have Gina Schell. Dr. Gina Schell is an internal medicine physician living with systemic lupus and the proud mother of a juvenile arthritis warrior. She's the Tampa board chair for the Arthritis Foundation, and along with her husband is the vice chair for the 2025 Juvenile Arthritis Family Summit. Next, we have John K. Frazier. John is a personal trainer with more than 32 years of experience, specializing in post-rehabilitation. At 27 years old, he was diagnosed with ankylosing spondylitis, or AS. So he understands how to help his clients work around physical limitations. He's also an actor and author of the book Through the Pain, the Silent Suffering and Triumph of the Personal Trainer. Gina and John, welcome. We're so glad you've joined us tonight. We're going to be discussing the common fear of worsening illness. Take it away, Destiny.
All right. Thank you. So Penny, we're gonna open up with you. I would love if you could share with us a little bit about some of your stressors of having a chronic illness.
Okay. Well, also always in the back of my mind is a concern that my meds are going to stop working. It's happened in the past. It was awful. It was like nothing was helping. Waiting for the next med to take effect and hoping that it's going to take effect is extremely stressful. Because I'm on Medicare, I have less options as far as medications due to the copay cost, and that makes it even more stressful because I don't have as big of an arsenal to choose from. So it does cause a lot of stress, and it has happened. I've also had 25 years of the disease before any of the good biologic medications existed. As a result, I had a lot of joint damage, and I've had many orthopedic surgeries as a result to repair the damage. I always joke that I'm held together with duct tape. And I never know what's going to fail next, which is very stressful because it's like, okay, I'm going to wake up today. What's going to be hurting? What's going to be a problem? I'm always sort of waiting for the next shoe to drop. That's kind of living with 42 years of it.
Yeah, and I bet most people in the audience can relate to that too. I think it's a common fear. I'm curious how you do handle that currently.
Okay, well, I guess having a background as a licensed clinical social worker, I've had a lot of training in mindfulness meditation, progressive relaxation. I do practice meditation. I do practice mindfulness, the acceptance of what's going on. Instead of fighting it, I accept it. I take either yoga, therapeutic yoga, or gentle yoga classes, and I found they're really helpful. They're good physically to keep me in shape, and it really does help loosen the joints. And it's also emotionally really, really, really good. All of it's been helpful for both my body and mind. I'm coping with it. It's not easy, but it's doable.
Yeah. And I think one of the things I often tell clients is that these practices are like brushing your teeth. You don't wake up one day and just say, well, I've brushed my teeth enough, so I don't have to do it anymore. You have to do it daily. You have to drink water daily. You have to eat breakfast, lunch, and dinner daily. And so this is an extra I think everybody should be practicing relaxation techniques and things that bring them joy and routines that bring some familiarity to your life. But there is no stopping point for it. We don't wake up one day and it doesn't need to be done anymore. And so then there's acceptance work to be done around that, right? We're allowed to kind of get in our feelings about that. Like, well, that's not fair. That's not right. That's, we're allowed to move through that. And then we lean on all of that to get us back to being grounded. And we really, and looking for as many moments of groundedness throughout the day and trying hard to pivot our attention back to what's working and what is going well, not to say that what's going wrong isn't there. It's not that we're dismissing that, but it is there, right? And so we have to find a sense of groundedness to let us put one foot in front of the other over and over again.
That is the acceptance way I look at things. It's like, I've got this illness. Some days I wake up and say, darn, why do I have to deal with this? But it's like, okay, enough with that. Let's just move on. I'm going to do what I need to do, have fun, enjoy my life, and I'm not going to let it ruin it.
Yeah.
I made that decision a long, long time ago. I'm not going to let this disease ruin me. I'm always dealing with something, but I also am dealing with a lot of fun things and enjoying myself, and I'm just not letting it get in the way of my life. That would not be a very good way of living.
Yeah. Does anybody else in our panel have something to add to this?
Sure. Destiny. Hi there. I'm John Frazier, as she said. I don't know, Destiny, did you steal that from me? Because I always talk about exercise as part of brushing your teeth. It's something you do. You know, it's not something that you finish. Oh, I'm done with exercise. I'll never have to do that again. And I use exercise uh, for me to cope. But I found that doing a gratitude list is very important every day. And sometimes it's just mental. You can write it down. You can do 5 things, 10 things. It doesn't matter. But I find that centers me with meditation, and also always, I tell people, that have an illness, get a dog, because you got to go walk them. You got to get moving. And my dog, she lets me know, and she didn't care that I have AS. She didn't care that it's hard to get out of bed in the morning. She's like, I got to go. So it's an incentive for me to get up and get going. And so to me, those are the things and I try not to think about future, I mean, because I try to live in the present and the now and be appreciative of what's going on now. Because and also there's people that have it a lot worse than I do, so I always appreciate the fact that this isn't great, but there could be something worse. So I always want to be grateful for, that I can get up today, I can walk, I can move, I can train my clients that I need to. So those are kind of the things that I try not to get too in my head about what's down the road. Because people, even without chronic illness, we can sit there and think, well, what if this happens and this happens and that happens, well, we shouldn't be doing that either.
Yeah, I think the thing about it can be worse. If somebody else says that to us, it's horrible. But for us, if you're saying that for yourself, and it really, there are for sure moments where I'm like, you know what, I can handle this, because if it were worse, I'd be crumbling at that, or and it can just give you a sense of perspective.
Well, yeah.
And I was just going to add that you can also write a plan for your worst case scenarios. You don't have to always say, it won't happen, or I have got to only worry about right now. We do want to come back to the present moment over and over, but you are allowed to write a plan of like, what would I do if the worst case scenario happened? Who will I reach out to? Where will I turn? What resources will I call? That can also bring a sense of groundedness.
So I think one of the things that helps me get through is having a routine. I found that way my body kind of knows to follow a routine. So on those days where it's not cooperating, my body's just a little bit more apt to keep going. If I have a routine, I tend to get up at a certain time, then I exercise, then I eat, then I do XYZ. And it does make things a little bit easier. And I think it also helps me from a calmness standpoint, because it at least gives me the illusion of feeling that I have a bit more control over things, even when the world may feel like it's out of control.
There's a question in the chat that we want to address. So any advice dealing with the fact that my joints will never improve, they will only get worse. So even though symptoms may improve for a period of time, I have a really hard time accepting that the goals of therapy are just to slow progression, that there's no hope to heal or improve.
So I personally think that although your joints, the physicality of your joints may not improve, that does not mean that your quality of life will not improve. And we as physicians see that all the time, that a person's level of pain or a person's functionality and their x-rays are not always a one-to-one match. Sometimes you'll see the worst possible x-rays and the patient will say, yeah, maybe I'll get a little clicking every now and then. That's about it. And other people's x-rays that really don't look that bad, but it's incapacitating to them. So I think I would not as much focus on, oh, well, it looks like XYZ, or, I know that this progression is going to look like this. There's so much more that goes into what is the quality of your life. we are not just single ingredient beings. There's so much that makes up that quality of life, from your level of activity to your support system to your diet to all of that.
Yeah, I just have to chime in. I think that that is key. I can honestly say I think I probably enjoy my life now more post diagnosis. I have the most fun. I have the most gratitude. And so you really have to look at life satisfaction and like how you navigate life. Um, because the truth is, it might not get better physically, right? You might have pain for the next 50, 11 years, right? But how can you navigate that and still experience joy, experience community, all of that? So I'm just, yeah, I'm glad you said that, Dr. Gina, because that's very true. I am living my life post my lupus diagnosis. So definitely.
I'd like to chime in there. I'm just stuck on this last line there. There's no hope to heal or improve. And I don't believe that, yeah, I have AS and that's not going to change, but there's hope to, I don't know if improve is the right word, but I can maintain my physical being the best I can and, and just fight the good fight. I'm just gonna, there's gonna be days where it's gonna be hard to move. There's gonna be days where I'm doing really well, and I'm gonna take advantage of those good days and have hope that I have more good days than bad days. So whoever asked the question, I don't want you to lose hope because yeah, the diagnosis might not change, but your attitude and how you approach it can. Because if you stay with a positive mindset, it can really do a lot for you to improve. If you're saying, oh, there's no hope, then, as we're talking earlier, the depression sets in and all these things, then it does get worse. So try to stay hopeful, whoever asked that.
Yeah. And I guess kind of in alignment with like how, like our perspective, right? We'll move on to our second point, discussion point. So I've mentioned a few times already, I'm getting married. Very big deal for me. However, in the back of my mind, I am still a little anxious about, am I going to have like a lupus flare when that time comes, right? And sometimes it can take a little bit of the joy right out of such a momentous occasion. So I'm wondering, specifically like Dr. Gina, have you experienced that to where, you're kind of like anticipating a big event and a flare simultaneously?
So first off, congratulations ahead of time.
Yeah.
So I think that that's always in the back of your head. And I, I've lived that plan B, if you will. I don't think any of us will make it through life, whether you have a chronic disease or not, um, living out exactly how you had pictured your life was going to go. And if so, then congratulations, you've won the life lottery, because it just doesn't happen.
Yeah.
Um, I know I went to medical school, went to residency, and saw my life going a single trajectory. Then I was diagnosed with lupus, and I was in a situation where I could no longer practice. It was, take care of myself, watch my 3 children grow up, and live on my 5 immunosuppressants, or go off my medications and treat patients, and live for however long I could. So I had to make the very difficult decision to give up the career that I loved. Um, but that wasn't the end of my story. That's where you have to learn to pivot, and realize that you recreate yourself. So yes, I've definitely had to, wait for the other shoe to drop. But you can also, look at that anxiety as excitement. with what else can, what's this next stage of my life going to bring? Because now, yes, I'm still a licensed physician, and I'm in a wonderful, much less stressful environment. And honestly, I don't finish every day with the question of who did I disappoint today because of my disease?
Yeah.
So sometimes, again, you just have to recreate yourself.
Yeah, and I think that is major. Just getting acclimated to the new you and creating structures and routines that fit the new you.
Yep.
Because yeah, even as I'm preparing for this wedding in April, like I'm taking the month off. And normally I would not have done that in the past, right? But I want to prepare my body and mind to have the best time. And I know I would need that rest and not to feel stressed or overwhelmed. So yeah, just recreating what that life, you know, can be, it's not the end of the world. Um, yeah, even with me, I use an oxygen machine at night because I have interstitial lung disease because of the lupus. I have mixed connective tissue disorder. So all those things. So I'm just coming up with like a little plan so that I can still enjoy my wedding, because I will be, drinking a little tequila. I'm gonna enjoy myself, So yeah.
Yeah.
Yeah, just recreating what that life is, establishing some structure for this new you. Super, super important.
Can I jump in?
Sure, sure.
Yeah, I always think of it as my new normal, or anybody's
Yeah,
new normal.
yeah,
Once you're not the same as you were, but that doesn't mean it's awful. You just have to find a new you within your limitations of being your
Mhm.
new normal. And
absolutely.
it could be great. It may not be what you were hoping for or what it was, but it could still be, you could still have a great life.
Absolutely.
It's what's on the inside that counts.
Yeah.
Cliche, but very true, right? Yeah, yeah. Yeah, so we discussed wrecking plans. So, talking about my wedding and whatnot. And
Okay.
then like relationships. Relationships is the last point of just how chronic illness, right, can impact relationships. So yeah.
Yes, yes. Okay, John, I think we're gonna talk about this for a minute. So how does your diagnosis impact your relationships?
Well, I'm an older man, single, and it's unusual to be at my age and be single. And it's very difficult to explain, why I'm single and don't have children. Um, and it was always a concern, when you get into a relationship, when do you tell? When do you reveal? When's the big, my last girlfriend, I remember the day I was like, okay, it's been a few months. I got to tell her. I might have a flare up soon. And, and you build up a lot of stuff. And so eventually, told her, and most of the time, and everyone here knows this, with chronic illness, other people that don't have that just go, oh, okay. It's like, it doesn't, and there's no impact because they don't understand. So, fast forward to, down the line, and my worst fear was revealed. I had a bad flare up. And when I have a flare up with a ankylosing spondylitis, fatigue is my main, pain is there. Pain's there, but for me, it's the fatigue that just makes me I just can't stay awake. So 9 o'clock at night, I'm like, I got to go off to bed. And she got mad, said the one thing that you never want to hear. She said, I don't think you fight your illness hard enough. And I went, okay. And to me, I knew that that was the beginning of the end, because you can't be with a partner that doesn't understand, or at least have empathy towards what you're going through. And I am not a complainer. Matter of fact, I rarely bring it up. I might have a flare up and I'll go train a client and it's painful, but I don't say a word. I'm not a complainer. I'm not a run around and tell everybody that. So it has impacted me. And now at my age, it's impacted me because, and as everybody knows, when you get older, not even having an illness, you don't want to go out anymore. You just want to stay home. Well, I don't meet anybody if I stay home. So, you got to get out there and meet people. But when you have a condition like that, it makes it more challenging. And tonight, I'm going to a big old LA soiree for a pre-Oscar thing, so I'm going to make myself get all gussied up and get out there and do it. So it does have an impact, but I think the right person is out there that would be compassionate and would be understanding. And I have hope that I'll still find her someday.
Oh, thanks, John, for sharing all of that. And I'm
I
both
got
feeling
more,
like,
but I know we got time crunch.
yeah, no, it was great. I mean, it's very, I think again, people can resonate with that story. One, I hope you have so much fun tonight. And also I would be like dead by an hour from now. So
Oh, I mean, 10 o'clock, I'm out. I'm like, oh, time to go.
But yeah, no, I think the most important thing is to remember there are a few different relationship tips. Since we are running short on time, I'll give you my biggest tips that I give to clients all the time. This would be a longer drawn out conversation in a session, or if we had more time, but one partner cannot be our everything. And so we always have to remember what our roles are, what roles we play and in other people's lives, and what roles we want them to play in our lives. And we can't play all the roles for each other. And two, every topic of conversation requires many conversations over and over and over again. There's never a one and done conversation in a relationship. It always requires maintenance. It always requires continued conversation. And John Free specifically, you mentioned, not complaining, not talking about it a whole lot. And I actually think sometimes we can, because we're so scared to feel like we're complainers, we don't talk about it enough.
Well, I wrote a book about it, so I
Oh,
put
good.
I put it all in the book. I mean, so I mean, it's like, whoa. Well, in the book, it's all there. So I don't, because I work with a lot of people that have other conditions and elderly people, and they're sitting there struggling. I don't want to.
Yeah. No, that makes sense. Yeah.
But I do have a therapist, and I talk to her about it because I don't want to be that friend that no one wants to pick up the phone because, oh, John's going to complain again. So, but I do have a best friend that I can talk to about it. My sister was also diagnosed with ankylosing spondylitis, and so we can have those frank conversations. But the last thing I want to say is that if you can't tell, I try to keep my sense of humor about it, and about everything, because to me, that might be the most important thing is to keep my sense of humor. And I've been in a lot of pain, and I still try to keep that going. So
Yeah.
I just want to say something really quickly. And I think too, because when you have chronic illness, sometimes you don't always present as such, right? Very lively, we're cracking jokes,
yeah,
hanging out. And so that's why it's important to really share with your loved ones, significant others, whatever, how you feel. No matter if it's 10 times a day, just really reiterating like your health status and your health symptoms. Because yeah, it's easy for them to downplay it because they're not experiencing it themselves. Um, and so it's just important to share. Yes, because I too am a funny person, and I think sometimes people are like, nothing's wrong with you. And I'm like, actually it is. I couldn't
well,
even get out of bed today. But yeah,
that's why I wrote the book, is because I was tired of people saying, because I'm a personal trainer, I look fit, and they don't see behind the
yeah,
that part of it. They're like, and then you tell them, and they're like, no, you don't look like it. And so that's
yeah,
why the subtitle of my book is The Silent Suffering and Triumph of a Personal Trainer, because the silent part was just the fact that people, if they don't know, they don't know.
yeah, yeah,
I think this also just speaks to the one single story that people have about different words, disability, certain different diagnosis. People have a certain image in their head, and the more we share, the more we get to break down the fact that we all look so different. And so this goes back to acceptance of accepting the fact that people are going to have a single story about you. They are going to have their own preconceived misconceptions about you, and our job is to keep showing up as we are without over explaining, without trying too hard, but to just speak normally about what is happening for us. And sharing through modeling, showing them through modeling who we are and what we look like. So it looks like it's time to go to the Q&A. Go
We're
ahead.
going to take a little bit of time to answer some viewer questions. Please, everybody, keep in mind we received questions before and during the event. We're going to try to get through as many as possible, but for questions we don't have time to get to, we strongly encourage you to visit the Arthritis Foundation helpline at arthritis.org/helpline. With that said, let's dive right in.
The first question is, any thoughts for chronic illness and financial stressors that go along with it?
Oh yeah, it is pricey. It can be pricey. So one of my recommendations is that you check GoodRx and any of those code giving sites for like pharmaceuticals, so like medication. That has been very helpful. It is ridiculous how I can just show the code and the price goes down 95%. It's wild, but it happens. And so for those who take expensive medication for whether it be like immunosuppressants or whatnot, definitely tap into some of those websites, some of those discount code for code sites for pharmacy sites. So you can get the code and then you can take it to, a traditional pharmacy to use.
Unless you're on Medicare, and unfortunately on Medicare, you can't use those codes, you can't get copay assistance. But fortunately, this year they put a cap of $2,000 out-of-pocket spending.
Okay.
So that's a little bit more reasonable than what it would have been before. It's still pricey, but you're not going to be spending $40,000 a year for your meds like it would have been before.
So what do you do when your body is screaming in pain and your meds aren't working?
So I think the first thing, and this is whether it's pain or it's fatigue or it's brain fog or any of those symptoms, communicate with your physician. I think so many of us, kind of similar to what Brentia was saying about, how we just kind of go along and everything's fine. And I can say this from the physician standpoint too, is so many of us go into the physician's office. How are you doing? I'm fine, blah, 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 blah. You just kind of go through the visit. You need to be an open book. You need to be very, very, very transparent. You're not there to make friends. You're not there to please somebody. You're not going to hurt your doctor's feelings. But I can tell you that your physician cannot take care of you to their utmost skill level if you are not being absolutely transparent with them. So give them as much information, as much detailed information as you possibly can so that they can help you. The other thing is, remember that pain relief can come in a lot of different forms, not just in the form of a pill. And, most studies really show that the best way to control pain is multimodality. And so that, that means utilizing a lot of different things, whether that be between stretching and massage and meditation and mindfulness and medication and sleep and nutrition and all of it together in order to be able to control it.
How do you handle chronic pain while being the caregiver to others? I was just diagnosed and have 2 young children who need their mother daily and nightly. Family has just said to learn to live with the pain. I have 2 kids, they're 1 and 3, so I understand this very well. It is extremely important that conversations around who is doing what in my household between me and my husband is done on a daily basis. The distribution of labor is really important to consider. When you are in pain and when you are out of commission, you're out of commission. And when you're not and you're capable and you're able to do things that day, then you do them. And again, this is conversation after conversation. One helpful resource that can be helpful, it's kind of a lot of mental labor, but then once you kind of get past the initial hump of it, it's great. It's called Fair Play. It's a book and it's a card deck, and it basically puts out all of your different like tasks that it takes to run a household, including a household with children, out on the table, literally in a card deck, and you distribute each task to people between whoever lives in your house. And this can just be really eye-opening around what really is happening between the distribution of labor in your household.
Also, I found it sort of helpful to lower my standards. If you have clean clothes, if they're still in laundry basket and they don't get folded, it's okay. People will still have clean clothes to wear. You don't have to have a huge fancy dinner on the table every night. When you're feeling good, make some things, freeze them. So when you feel awful, just pull them out of the freezer. It's okay. It doesn't have to be perfect. Not everybody's going to be Martha Stewart with, the perfect house and everything else, and it's perfectly fine.
And that is exactly how my life looks. There, we live off clean laundry baskets. The
Yep.
laundry is clean, and my kids go to daycare with clean clothes, and that is all anyone can ask of me right now. And frozen broccoli. Like, we just keep frozen vegetables so that I know I'm putting something green on my kids' plates, and that's it. Okay, the next question. My child has juvenile arthritis. How do I help her deal with her own anxiety of having a chronic illness if I have my own? I want to seem strong for her, but I'm worried about her future.
So I think I can grab that one as I live with that. And if I'm interpreting this correctly, both mom and child have a disease, which living with that. Communication. I would say, as a mom, we have a tendency to want to protect our children, which is only natural. However, there's a difference between protecting them and sheltering them. And we're not necessarily protecting them if we're sheltering them too much. So I think you have to have caring but very honest conversations. I think age appropriately get them involved in their own care, because that gives them a sense of control and gives them a better understanding of what's happening to them. Be honest with them. If you have the disease yourself, I will tell you, and if my daughter was here, she would tell you as well. She's watching, plain out. She's watching. And so not necessarily even what you're saying to her, but the way you're leading your life and how you're presenting yourself is really what she's zoning in on more than anything. So that means things such as you have to care for yourself. You have to put your mental health as a priority. You have to be taking your medications, getting all of that. All of that has to be a priority. Otherwise, you're unintentionally giving her the message that that's not a priority. So that's some of the best advice I can give.
Yeah, and I just wanted to add, that's exactly. And when you are looking at your child and you're feeling your anxiety and then you're feeling their anxiety, that is where emotion regulation and distress tolerance skills, which you can learn in therapy, or honestly, like, you don't have, therapy is not the only option. It helps to have the support in it. But those distress tolerance skills are going to help you so much that you actually feel grounded, that your child will then feel that from you. And then when they're scared, it's not like they're scared, I'm scared, and it's then I'm scared more, and then I'm scared more, and then I'm scared more. And now we're both like spiraling down. It's more like, you're scared and I've got you. Just like when your child was a baby and they were crying and you knew that they were hungry, okay? And you were warming up a bottle and you're shaking them and it's okay, mommy's coming. I'm going to get you that bottle. Or whatever it is that you would say to them, you had a sense of, you knew it was going to be okay because the bottle was right here. you don't always know it's going to be okay when your kid is sick, and that's where the difficulty lies. But we want to learn how to embody that same, like, it's okay, mommy's here. So I hope that helps. Let's see. Next question. How do you deal with no longer being able to pursue the one thing which gives you pleasure? For this particular question, it's oil painting.
I could answer
Oh.
that one. I played basketball in a league most of my entire adult life. And about 5 years ago, I had to hang that up. I retired officially from the NBA. No, I kind of looked at it that way. I was like, okay, guys, I'm gonna step down here. But and it really sucks. I mean, let's just say it like it is. It sucks. I loved it. It was one of the most fun things. I was very good at it, and I loved playing basketball. But it got to the point where the pain wasn't worth, I mean, the recovery, it'd take me all week to recover just to be able to play again. And it just got to the point where I know that was time. And I always still have hope that there might be a time where I can go back and maybe do a little bit, and try to get into it a little bit. So that always kind of keeps me like, I never think that it's over. Like, I still think, and I have since gone around and I can shoot around and I can shoot some free throws and stuff. And so I can still be a part of it. So I never give up hope that I can still get back to it. So if your oil painting is your thing, maybe there was a time depending on what I don't know, it doesn't say what your condition is, but maybe there'd be a time that you could get back to it. So never give up hope in the fact that it could come back around.
Or I found reinvented myself. I was an avid tennis player. I played on the team in college. I played as an adult. And then once the arthritis developed, I just couldn't. So I took up golf. And then I developed spine issues because of the arthritis. So I had to stop golf. And I went back when I was in high school. I played drums in the marching band. I just said, I'll go back. I'm going to take lessons again. And now I play in 2 bands. I've taken voice lessons. I sing with the vocal group. I can't play tennis anymore. I can't play golf, but I can play percussion and I can sing. And so it's doing something different. It's sort of a reinvention of myself. It may not be what it would have been ideally, but it's still terrific. I think a lot of it is your attitude over it. Instead of saying, oh, I can't do it. I can't do it. I can't do it. Well, what can I do? And make the best of it.
I totally agree. I think also allow yourself to go through the grieving process. I think so many of us, we want to kind of skip all those stages and go straight to acceptance. That would be so much easier and nicer, and cleaner. But we do have to go through the denial and the anger and the sadness and the bargaining and all that stuff so that we can get to that acceptance and that recreation of ourselves.
When I was first diagnosed, I had dreams of tennis. I was always in tournaments and I was always winning. And that was my way of grieving the loss of the ability to play. And it took a while, and then the dreams went away and I found other things in my life. And it's a grieving process and it takes time. Okay, do we have time for another question?
Yes, looks like we've got 2 more. All my labs are fine, but I still feel sick. My doctor doesn't believe me and just says it's all in my head. I'm starting to believe that he's right. Can my anxiety make me feel sick? I can speak to this. Anxiety can make you feel sick. That does not mean it's all in your head. I want to be very, very clear. Our anxieties, our mind and our body are constantly interacting. It's a bi-directional process. There is no, you have this thought and it causes this sickness or this pain. It's more like you have this little feeling in your body, shoots up to your brain and says, hey, we're experiencing pain. And based on all our past experiences, being not heard, being without answers, not having treatments, being dismissed, whatever, all of those past experiences tell your brain. So remember, when we're in pain, it's dangerous. Even if that pain isn't dangerous, that is happening. And that can exacerbate symptoms. again, how do you know if that's what's happening versus a symptom that is like more like something your doctor can treat? That's a difficult thing to figure out, especially when you've had a history of being dismissed around your chronic pain. And that, go ahead, Gina.
I think exactly what you finished up by saying is the most important thing. The relationship between you and your doctor is, I mean, that relationship creates the foundation of you being able to have a successful treatment regimen, no matter what it is that you all are working on, whether it be hypertension or heart failure or rheumatoid arthritis, because it's upon that trust is built. And so whether it was intended, you know, to come across as it's all in your head or not, it sounds like there's some trust issues between you and your physician, which I think I would be concerned about that. And sometimes, honestly, finding the right doctor, it's kind of like finding the right mate. Sometimes you got to go through a couple till you find the one that's the right mix for you. There's never going to be one doctor who's the perfect doctor for everybody. So, I mean, it may be time, to either have a very, you know, honest conversation with your physician to see if that's a place where the communication and the trust can be rebuilt, or if not, maybe finding someone who you can build that trusting relationship so that you can move forward.
Yeah, I'd like to speak to this because when I was diagnosed 27 years ago, it was a very hard diagnosis back then. They didn't have the tools and the biologics, all the things that they have now for AS. So, and I was told many times it's in your head, and I knew it wasn't because, you know, but you just start second guess yourself. And I don't like it when physicians say that to you because it starts to put the emphasis back to you. And like Gina said, you know, you got to kiss a lot of frogs sometimes to find the right one. And you know, so I went through several doctors until I was able to get the right diagnosis. So whoever asked the question, don't give up and don't blame yourself. You know, it's important to make sure that you find the right doctor that will take you seriously, that will go through the right procedures, and you might have to go to a specialist. If it's arthritis, you might have to go to a rheumatoid arthritis, you know, someone that can take care of you that way. So, but if you know that there's something wrong, you know your body better than anyone else. So just keep going until you find out what exactly is going on.
Okay, great. We need to move on. That'll be our last question. Can everybody give everyone on the panel, one takeaway that they could share?
Sure. I would say, know what you want, cherish what you have, and fight for what you need.
Very good.
Very good.
I wrote this in the chat for everyone, but the curious paradox is that once I accept myself as I am, then I can change. This is a quote from a famous therapist from way back in the day. So this is my leading mantra.
Are we only doing quotes? Can I? I always love the quote from Shawshank Redemptions, and I do it to myself. I tell myself this because sometimes it's hard. I'm saying get busy living or get busy dying, you know. And I know it's a simplistic thing, but it basically is saying, you know, put one foot in front of the other and keep going, and try not to. I know this is going to sound hard, but try not to focus all your attention in your condition. You know, try to put the emphasis on other people and helping others and really loving life and the world around you, and don't get trapped in just always thinking about, oh, because we get sometimes internalized because it's our pain, and it's all in here. So we need to open up and see what else is out there and not just worry about the pain that we feel inside. You know, all the things that that are great in the world and focus on that.
My takeaway is, it may sound a little corny, but if life gives you lemons, make lemonade. Make the best of it. Yeah, you've got a crummy diagnosis, but you know what? You can do it, and just make the best of it. Okay, I just want to go over a few resources from the Arthritis Foundation before we finish up. There are going to be a few more webinars coming up soon. On March 27th, there's an osteoarthritis care and regenerative medicine. And on April 24th, decoding inflammatory arthritis meds and labs. So sign up, tune in. You can register at arthritis.org/webinars. There's Live Yes Connect groups. The Connect groups are a great way to get support and learn about positive coping strategies to manage your arthritis. The groups meet either in person or online. I co-facilitate the psoriatic arthritis. That's an online group. There's some that are online, some that are live, some that are hybrid. So check those out. We have over 50 groups based on your community preferences, interests, and disease types. Learn more about them at connectgroups.arthritis.org. In the survey, in a few days, that you'll be receiving the survey, it'll be asking you about your experience tonight. Please take the time to fill out the survey completely and honestly so the foundation can best serve you in the future. And I'd like to thank you all for being here. I'd like to thank all of our panelists and speakers. It's been a great presentation. I hope everyone out there enjoyed it and got something out of it. There was a lot of good information presented. So thank you. Take the survey, let us know what you think, and join us next time. Have a good evening, everyone.